and child abuse is here. My first guest is Dr. Arora, who is actually an allergist. Okay, allergy season, well, I would say is coming, but the weather we've had, I mean, I'm thinking I'm seeing allergies now, but it really is more likely to occur in the spring.
Right, and we are seeing it earlier this year with the mild winter we've been having. In fact, we've actually started seeing pollen for trees already come out, and it's only the middle of February.
So that explains some of the wheezing and snotting and all kinds of symptoms. So what are symptoms that you think, maybe this is an allergy?
So the typical allergy symptoms are nasal symptoms like runny nose, sneezing, itching. Also, you can have eye symptoms like itchy, red, watery eyes, and then also breathing symptoms as well. So coughing, wheezing, shortness of breath, chest tightness. So those are the typical things we'll see.
What's common, especially spring in Kentucky? What causes that?
So usually it's the pollen. So initially we see the tree pollen come out, and in typical years it's toward the end of February, early March, but again this year it looks like it's going to be earlier, so we'll probably have a longer pollen season, which means more allergy suffering this year. And then as the tree pollen goes down and toward the end of spring and into summer, we see the grass pollen come up as well, and that's on top of your year-round allergens like the animals and dust mite and mold and those kind of things.
And you mentioned all those other allergens. It could actually be anything, perfume or soap, or anything can cause allergies?
Well, some people will be very sensitive to strong smells, and that acts as more of an irritant response. The fancy word for nasal symptoms from those irritants is vasomotor rhinitis. Allergies go through the immune system, so it's a little bit of a different process than the strong smells, but the symptoms are almost exactly the same, so it can cause a lot of problems in both types.
So if you want to treat it, there's some things you can do before you end up at the doctor?
Yeah, so there are some over-the-counter medicines that you can start with, and there are actually a lot of good ones. First off, the top-line medicine is really the nasal steroids. So that the typical medicines in that category are like Flonase, Nasacort, Rhinocort are all over the counter. That's a good place to start, but it works best using daily. And it takes about a week or so to get the full benefit. So don't give up after just a couple days. The other medicines that are commonly used are the antihistamines, and those were out over the counter even before the nasal steroids. So those are like our Benadryl, Zyrtec, Allegra, Claritin. Usually the latter three will last a little longer, have less of a sedation potential. So that's a good combination to start off with. But then if that's not cutting it, that's where we can help.
Well, that's what I end up. As a primary care doctor, I try all these things in addition to prescription medicines. They all fail. They end up at your place. So tell me what you would do different as an allergist.
So the first step is really identifying what those allergies are, or even if it's allergies at all. So that's the first question to ask, is it allergies or not? And then if so, what are those allergens? And we can figure that out by doing testing. And the typical way we test for allergies is with allergy skin testing, where we use little plastic toothpicks, their skin test devices dipped in the different allergens, and we put them all up and down the back, very quick test. We can do it in all ages, children and adults, and we read it in 15 minutes. A positive test is like a mosquito bite, gets raised, red, and itchy, and then that will identify what that person is allergic to. And then when we know that, that's really the first step. That's the key in coming up with a good treatment plan. And once we have that information, we then individualize that treatment plan, and that includes, there's really three parts to treating allergies. It's avoidance of the allergens, medications, and immunotherapy or allergy shots. So we can come up with an individualized treatment plan for each patient based on those test results.
So you start with avoidance. That's obviously, if I'm allergic to grass, don't get around that grass. What about like air filters or furnace filters? Do they help?
They can, absolutely. And so you're absolutely right. We can't live in a bubble. Unfortunately, we're in Kentucky. We're going to have a lot of pollen out here. You walk outside your door during pollen season, there's no escaping it. But there are some things that you can do to help. And one is key, just what you mentioned, is making sure the air filters on your HVAC system are changed regularly. Usually we recommend every 3 months. And you want to use good quality filters as well, filters that are good at getting rid of those allergen particles like the pollen or the animal dander, those kind of things. Then we also, during pollen season, recommend when you're indoors, keeping the doors and windows closed, because those are entryways for those outdoor allergens to get inside and cause problems indoors. And then if you are outside, again, we still want you to be able to do things you want outside. If you go outside and come back indoors, we recommend changing your clothes, taking a bath or shower, trying to get off any of that pollen that may have ended up on your clothes. There are other avoidance measures too for some of the year-round allergens like dust mite, using covers on the pillow, mattress, and box spring, and then also washing the bed linen in hot water once a week.
Well, that's great information.